Welcome to Nasdaq TradeTalks. I'm your host, Jill Malandrino, global markets reporter at Nasdaq. We're coming to you live from CES in Las Vegas, and joining me for this segment, we have Sokwoo Rhee. He's Executive Vice President of LG Electronics and Head of LG Nova. We're here to discuss healthcare tech, the impact of AI, and we'll also look at some specific examples to help with rural obesity and chronic care issues. It is great to have you with us, Sokwoo. Welcome to Trade Talks.
All right, thanks for inviting me, Jill.
This has been a really important topic here at CES in 2025, is healthcare tech and the impact of AI and what it's allowing clinicians to do and better outcomes for patients.
Absolutely.
I mean, just the size of the space that healthcare occupies now is definitely a testament.
And that is a big change from last few years. Healthcare has been always on the top of this technology, but this year I see a lot of actual implementation and actual practical application using AI and so on.
How has AI has become part of the consumer vernacular, in 2022, but AI is not necessarily new to the healthcare and tech spaces. How is LG Nova leveraging AI? How has it helped to transform the industry?
Absolutely. So healthcare is a huge market as right now, but it has been less than ideal disruptive technologies introduced to that industry because it's so conservative and it has to be long-term industry. Now AI is making changes because now we can help doctors, the physicians, to make a better decision, faster decision, and do that with the economics and efficiency in mind. So that is a big change.
Yeah, so you can actually make quantitative decisions instead of having to rely specifically on clinical and gut feelings.
Exactly.
Yeah. Well, it's interesting, and the reason addressing rural obesity and chronic care issues stood out to me. In the US in particular, we are going to face, I think it's almost 15,000 shortage of physicians by 2030, 2035, which is why we're leveraging APRNs and APNs more for general practice care. How can this technology be leveraged to address rural obesity, which is probably the biggest factor that leads to chronic care issues in the US?
Exactly. So obesity, for example, has many different reasons why it can become a problem. Lack of right treatment and physicians who interacted with them with a frequency that is adequate to manage those conditions. So in short, basically, they cannot see doctors often enough, basically. So this is where these technologies come in, and doctors can see the patient probably once every week, a month, or 3 months. You need to fill the gap in between. You need to be able to monitor them. If there's any kind of situation that you need to alert the patients, that's when doctors can. It's more like instead of just being constantly monitoring on a window, on a snapshot, it's more like you can monitor them and provide actions for you.
So the technology, let's say it has daily tracking, will feed into the physician offices and so forth?
Absolutely. And obesity and diabetes, for example, and any other chronic conditions, that's the golden rule. You gotta keep tracking, you gotta keep working on it. Doctors cannot help working on it on a daily basis. That's where this technology is coming.
Right, and of course, because so much of the population is exposed to these chronic issues, the data is just getting better, or data begets more data. Of course, I have to ask, and you brought this up at the beginning when it comes to data privacy, because it is so highly sensitive.
Absolutely.
And to your point, the healthcare industry, whether it's or other data restrictions, does that hinder innovation at all, or how are patients responding to it? Is another question.
So I wouldn't say hindering it, because but it's more challenging because you gotta work with the rules and regulations, which is put in place for the right reasons. So it takes time, and that's one of the reasons why healthcare sector is slow in adopting new technologies like AI, but it's happening because the benefit completely outweighs the delay and downfalls. So right now, I see that it's being adopted much more faster. Privacy is going to be always on top of the mind for everybody. I wouldn't call it hindering factor. I would just call it just needs a little bit more work.
Yeah, I mean, even if you want to think from an economic perspective, if you could get chronic care issues under control, in theory, insurance costs should go down.
Absolutely.
The healthcare space would hopefully get more efficient. Less time off of work, more money back into the economy. I mean, you can see where this is going.
And not just that, there's this underserved communities. You talk about rural areas, right? And we work with West Virginia intensively. That's one of the states that has a lot of these chronic conditions. And there's a less than ideal number of hospitals, for example. And its access to those medical professionals is fairly, it's not that easy over there. And that's where these technologies can come in and again, fill the gap between the treatments and seeing the physicians in between. So that's, I think, we can have a lot of impact using this technology.
Yeah. Do you have any insight in terms of how patients or clients are responding
Oh yeah.
to it? Because at the end of the day, look, if this brings down healthcare costs, which is frightening for a lot of people, it can only benefit them. But I also can understand you want to, meet with your doctor as well. But are they responding to it?
Hey, so the way that we approach it, which is true, is
Yeah.
that we are not trying to take anything away from
Right.
the existing system. We are augmenting it. We are helping. When doctors see patients probably once a month, and they see that the condition has changed dramatically, and the patients can become worse than what they say. Now we are preventing it from happening, so doctors can come with a better result. It's really helping doctors to perform, at a completely different level, and making and helping better perform their duties.
All right, we appreciate the insight. Sokwoo Rhee, thanks for joining us on Trade Talks. And thanks for joining me from CES. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.
Thank you very much.